This presentation is on digital solutions for global health security. The global health security is described as existence of strong and resilient public health systems, which protects people or citizens from threats to global health. And we have to see what are these global health threats. WHO describes 10 threats for global health, ranging from infectious diseases or non-infectious or non-communicable disease conditions, climate change, drug resistance, and to weak primary care health systems. On top of that, the global health security agenda works on this issue, and they have proposed action packages to prevent, detect, and respond to these threats, and to make the world safe and secure from infectious diseases, and to promote global health security. Then we have to talk about digital health and digital health solutions. We all know that digital health or digital technology have applications in all the areas, all the fields. So when it comes to the health and global health, digital health can play an important role by promoting equity in access to the health services, and by strengthening the health system and public health. Ultimately, these two contributes to universal health coverage. As previously mentioned, the global health security is about public health and health systems. So any public health action, action can be categorized into, in a public health event, the actions can be categorized into based on different criteria. We selected this criteria. First is to identify, then to detect it, then we have to do data collection and analysis, then we have to implement an intervention to overcome this. Then we'll have to monitor the progress, disease progress, and the progress of the effectiveness of the interventions. This goes on as a cycle. In the field of digital health, these actions can be supported. How digital health can support identification of a threat? There are several concepts that can be supported by digital health. As an example, social listening, self-screening, health-seeking behavior analysis, infovalence, and infodemia. These are the concepts that can be directly supported by digital health interventions or digital health applications. All the details of these interventions and descriptions of all these things are included in the report, which will be distributed with you in the maybe after the meeting, maybe in a few weeks' time. So once the threat is identified, it has to be confirmed. How do we confirm? We do it by laboratory investigations. In laboratory investigations and dissemination of the results, there are certain things that can be done by using digital technologies or digital health interventions. Also, there are some new approaches for disease identification, like COVID-19 breath test system, which was initiated by the Singapore University, which identifies breath biomarkers by analyzing them using AI tools. Then once data is collected, the data has to be analyzed and disseminated. For that, there are several tools that can be used, and those tools can create dashboards for dissemination of information. Then we have to continue with monitoring and evaluation. We have to both monitor the progress of the threat or the disease, and we also have to monitor the interventions, how to identify the effectiveness of those interventions. Then regarding interventions, in order to break the vicious cycle, we have to intervene at some point. These are some of the interventions that digital health can support. As an example, in COVID-19 infection, we know there were contact tracing apps, and they were doing active surveillance, and there were also many alert systems. And after the introduction of the vaccine, digital health tools are widely used for to improve the vaccination drive. And at the same time, there are digital tools which are helpful in health education and empowerment. With all that in mind, we did a study on mobile technologies used in the current COVID-19 pandemic. This study was done from May to October 2021. What we tried to find out was what are the mobile app functionalities which have supported the COVID-19 pandemic. Then we tried to find out what are the applications used around the world at the moment. Then we also try to find out what are the innovative approaches that are used by these applications, these mobile applications. So we had to do it in a rapidly. So we tried to find scientific publications, as well as we focused on great literature. At the same time, we have to get information from websites and applications like Google App Store to collect information or gather data needed for our research, our study. Then we created the list of functionalities. Then we selected a set of application mobile apps implemented around the world. We selected 12 applications. Then we also try to identify innovative approaches, as I mentioned earlier. So when we did our search, we found about 750 apps and articles. Altogether, there were about 750 apps and articles. Of course, there were overlaps because one application may be described in more than one article. Then at the same time, we wanted to know what are the mobile app functionalities for what user, what are the functionalities that have been implemented by mobile apps. For that, we found out 3 articles which describe mobile app functionalities. Of course, there were some overlaps of these between these 3 articles. Then we try to pick up 10 because we cannot analyze, so we cannot focus on hundreds and hundreds of functionalities. So we selected a set of 10 mobile functionalities which were commonly described by these 3 articles, and these are the 10 functionalities that we focused our research on. Then we selected a set of 12 countries from 3 different documents which were published. These are we try to identify the mobile application which is sponsored or promoted by the respective governments, to give it some weight. Then we try to understand how these applications have been used in each country. Although we talk a lot about mobile applications, we found out that only about 10%, around 10%, or little about 10% of the population was actually using the app. That was in a way that is based on the statistics that we found from the Google App Store. Then We also try to find out how many absolute downloads were there from each app. We found that Germany, Thailand, and Vietnam had significantly higher numbers of downloads, but nevertheless, they were, only about 10% of the people were actually using the app. Then we try to identify these what are the functionalities that are being used by these apps. We found that almost eight apps from these 12 apps that we selected had more than one function. And if 4 apps had only one function, and that function that is to do the contact tracing. The most frequently found function was contact tracing again. Then when we went through the applications, we found some innovative approaches that were used by these apps. One was gamification. Apps were promoting use of the apps by gamifying it. Then there were some apps which have incorporated common mobile app functions like calendar or female health calendar into the COVID-19 mobile app. And there were some apps which are using different modalities for contact tracing, like credit card transactions, mobile phone location sharing, which was acquired from telecommunication services, and CCTV footage. So finally, we came to know that about 50% of countries have not used the mobile app at national level, and we are identified that as a shortcoming. And as a solution, we thought it is good to develop a global app for pandemic security. And that brings us to the end of the lecture. Thank you, everyone, for your kind attention.